Welcome back. New Montefiore research finds that COVID-19 can cause acute cardiac injury. Joining me to discuss the short and long term effects this could have on COVID-19 patients is Dr. Tim Duong of Montefiore and Albert Einstein College of Medicine. Doctor, thank you so much for joining me.
Thank you for having me. It's a pleasure to be here.
Now, as part of Montefiore and Einstein, you took part in a study looking closely at the effects of COVID-19 on cardiovascular health. Can you tell me more about this?
Absolutely. So as you all know, COVID caused a lot of medical issues, a lot of problems, including multi-organ injuries. One of those uh, problem is the causing injury to the heart, something known as acute cardiac injury, which is a major complication of COVID-19. Patients who have acquired ACI has a much higher risk of serious illness as well as death. And because of this, we undertook the study to investigate the incidence of ACI in hospitalized COVID patients and whether or not ACI persists longer term in COVID survivor.
Now, can you actually explain what acute cardiac injury is and how it disrupts our health, our heart health, actually?
Yes. ACI is defined as an elevated troponin level in the blood. Troponin is a protein found in heart muscles. Normally, you will not see troponin in the blood, but when the heart muscles are injured, troponin leaks out and into the bloodstream, which can be detected. So an elevated troponin level in the bloodstream, which can be assessed by blood tests, can tell you whether or not the heart is injured. So ACI is an indicator of damaged heart muscles, and potentially it could lead to additional cardiac complications, including heart failure. So that's how it could potentially damage the heart and cause heart failure down the line.
Now, researchers found a similar pattern with the flu, which I thought was super interesting. Can you just tell me a little bit more about that? And can you just explain how COVID can also cause ACI? Like, why do we see that similarity?
Yes. The two viruses are in many way very similar. The flu virus and the COVID-19 or SARS-CoV-2 virus are very similar. So in some way, it's not very surprising that they are similar. But the SARS-CoV-2 virus is also unique in the sense that it's known to be very aggressive and it causes a lot more problems than the flu. As you already heard in the news, it's much more transmittable and it's much more cause much more severe illness and mortality and affect a much larger populations than the flu. So that's differences as well as a similarity. There are a lot of things that we still don't know in terms of the long-term effects of how SARS-CoV-2 affects the heart or elsewhere in the body.
Now, what were your overall major findings from this study?
Right. We carry out a study where we look at patients who have ACI versus those that don't have ACI during hospitalization due to COVID. We do a retrospective study where we look up a large number of patients within the Montefiore Health System and Albert Einstein College of Medicine. There are approximately 11,000 COVID positive patients within our health system through, I believe, from March 2020 to June 2021. What we found was that 40% of the hospitalized COVID patients had ACI, and 90-something percent of those patients had ACI within 24 hours of hospitalization admission. So very early on, very fast. This is in contrast to other organ injury that we found also, for example, kidney and the liver, which also are damaged by COVID-19. But those two, kidney and liver, a few days after hospitalization, whereas ACI occurred very immediately. And one of the reasons why it's so early potentially is that the SARS-CoV-2 virus infect the cells via something called an ACE2 receptors. And the heart has very high density of the ACE2 receptors. So therefore, it's a little more susceptible to injury due to COVID-19. Another possible way that the heart got damaged is because the fact that when infection occur, there are systemic hypoxia, sepsis, inflammation, out-of-control immune responses, etc., that could cause secondary damage to the heart. So the first is that the heart can be damaged directly by the virus, where it got infected cells, gets in the cell, multiply, and spread. And the second way is in the direct way, where the host response causing problem that's out of control. So our major findings are that 40% of the COVID patients who were hospitalized due to COVID had ACI, and 93% of them had ACI very early, within 24 hours of hospitalization. Another major finding is that COVID patients who had ACI were 4.5 times more likely to die in the hospital compared to those without. This is significant because you can imagine they have 4.5 times higher mortality rate. And this is adjusted for age, sex, and major comorbidities. But another major finding is that a significant number of COVID patients with ACI return for follow-up care. And of those who return, 56% still have persistent cardiac injury about 2.5 months on average after hospital discharge. This is, again, very different from other organ injury. For example, in liver injury associated with COVID, 90% recover at this time point. That is 2.5 months after discharge. So the heart is particularly susceptible, and it seems to linger on longer than usual, at least up to what data we have so far. The last but not least major finding is that we identify certain blood markers that could help us to predict which COVID patient or which COVID survivor are likely to recover from acute cardiac injury and those who do not. And thereby we can identify risk factors that can help us to treat and monitor patient survivors.
Can you tell me more about the importance of recognizing these, symptoms within these patients, especially if we're talking long-term effects?
Right. So cardiac injury, acute cardiac injury is happen in other conditions as well. So there's in some way nothing new on that. So whatever the standard care, shortness of breath, or other symptoms associated with cardiac function, or labor breath, for example, or chest pain, etc. So those are the standard symptoms that you will see. So this is not something unique. So you would basically follow your doctor's advices, or if there's some symptom shows up, you would go and see your health providers.
Now, in New York City, the Bronx is known to experience the brunt of most disparities, unfortunately, dealing with the effects of COVID included. Do you think this will present unique challenges for a borough that is already struggling in regards to health?
Oh, absolutely. I can speak broadly to that, not necessarily for cardiac injury, but broadly, COVID-19 really accentuates disparity, health disparity specifically. We know that our patient cohort have typically more pre-existing health conditions such as diabetes, obesity, and hypertension, which, by the way, are the major risk factor for severe COVID as well as mortality. Our populations also have less awareness of the disease. And also by the conditions we're in, there are also challenges in social distancing because we lived it in more crowded conditions in the city compared to elsewhere. There's also potential issue with socioeconomic status, access to care, among other things. So yeah, unfortunately, COVID just makes the whole situation a lot worse. It's like a perfect storm. And simply put, COVID really widens the health disparity that we experience in our population.
So we have just about 2 minutes left. Can you quickly just let everyone know what they should do in the meantime just to protect their health while more research is being done on this?
Yes, as you alluded to, there's still a lot of things that we don't know. The long-term effects on the heart by COVID is, and many of them, one of the things that we do is still trying to understand this and to follow up patients longer term and see if the negative effects of COVID on the heart is persistent or is and because of that, a lot of things still unknown. What we can do at this point in time is that just be aware of the situations, the symptom that shows up, talk to your care provider, healthcare providers, talk to the doctors. And also, one of our effort is also to make or help physician or make physician aware of this ACI associated with COVID, so they can pay attention in the complexity of treating COVID. If more physicians are aware of these conditions, and the patient can also bring the attention to their healthcare providers that, if you have symptoms, talk with your doctors. I think that's the best we can do. In addition, there's also websites from the NIH, the CDC, as well as our Monty Health and Einstein main website. You can find resources about COVID in general, not necessarily for cardiac injury, but in general.
And here's another resource on screen. Doctor, thank you so much for joining us. We really appreciate having this really important conversation. We'll be right back with more Open BxRx Tuesday.